Welcome to Stress-Free Retirement, presented by Oklahoma Financial Group, your source for solutions to live a stress-free retirement. I'm Reed Mullins. Alongside, we have our experts today, Michael White and Doug Rodwell. Gentlemen, welcome back. And we have so much more information to tackle today because last week kind of got introduced to everyone. But we're going to get down to a pressing need today that is kind of time base, because you mentioned it last week, Michael. I saw a commercial. I think we need to sign up for a Medicare supplement. So we're going to start seeing a lot more of those. So we're going to talk about Medicare today, and Medicare made 123 easy. Now, the number is 405-310-0098. 405-310-0098. Now, that's not the number to the show. That is the number to Oklahoma Financial Group. But the answering machine's ready to go, so leave your name and number. Love to call you back at the beginning of the week. The website, which has a load of information on it, is okfingroup.com. That's okfingroup.com. And we also have a couple of email addresses. And now we're going to give these out a couple of times. So if you're like me and you're probably scrambling for something to write with, that's okay. We'll give these out again for you a couple of times during this show. You can get in touch with Michael at Michael, Michael, at okfingroup.com. Or if you want to talk to Doug, Doug is Doug at okfingroup.com. Now, we also have a workshop coming up. We're going to give you plenty of things to write down today, so get ready to do that with a lot of great information coming your way. All right, Michael, Medicare made 123 easy. Now, you had to do a lot of digging and investigation and learning probably yourself before you did this. And
yeah, well, we definitely didn't get to this point overnight.
No.
There's been quite a bit of work that's put into this. And one of the first things I like to do is plug our informational Medicare workshops that we do. I do want to point out that they are informational workshops. They're not sales meetings. They're not sales pitches. It is an informational workshop that is a lot deeper. We dig into it a lot deeper than we will on the show today. Okay. So today is going to be kind of a highlight of what we talk about during those workshops. Our website, that's a great place to go at okfingroup.com.
Yes.
You just gave out all of our contact information. You can also, our contact information is on our website. Along with that information, we also have our upcoming events, different places you can go to these seminars, these workshops. And we're still updating it. We're constantly updating it as we get new times, new places, things like that. So go to the website, RSVP. That way you can RSVP over the phone number, email address, however way you want to get in touch with us. Of course, there's no cost for these workshops. They're absolutely free.
And I'm not going to have to buy a stack of books.
No, absolutely not. In fact, all that mail you get, all that stack you got in the mail.
How about that?
You can bring that with you. We'll tell you what to throw away and what not to throw away.
Oh, okay. I need you during political season too.
Yeah,
then,
right? Yeah. Well, one of the first things, now that we've gotten past that, I'd like to talk a little bit about the history of Medicare. Okay. Don't want to spend a whole lot of time on it because it's not all that important to the decisions you need to make today, but it's good to know where we came from. And Medicare was started back in 1965. It was led by President Johnson. Congress created the Medicare to provide health insurance to people that were 65 and older. The reason being, people that were aging 65 back in 1965, there's a lot of 65s around here, only 65% of them had health coverage because it was getting too expensive. They couldn't afford it. So they created this system to help ensure that seniors during retirement would have medical insurance. So that's really kind of where Medicare came from. And back in 2003, under President George W. Bush, they created the Part D plans.
Yeah.
They went into effect. The legislation took effect in 2006. The first plans were sold in January of 2007. So the Part D hadn't been around as long as Medicare itself, but it's a good addition to the program. Medicare has 4 parts: Part A, B, C, and D.
Okay. Back
in 1965, when they created it, it only had Part A and Part B, what we refer to as original Medicare. Doug's going to touch on that here in a little bit, but as we move on, we're going to talk a lot about A, B, C, and D. And so the key word there is the word part. Medicare has 4 parts. Now, there are plans that also use letters, and they do that, and it's so confusing. I wish they use something other than letters to label Medicare supplement plans, but they don't. So Medicare is 4 parts: A, B, C, and D. Now, one other thing that people might ask is, how's Medicare funded? Generally through taxes.
Sure.
Part A,
Yeah.
about 2.9% of everyone's payroll taxes go. Everyone's payroll, 2.9% of that's going towards Medicare. Usually half of it paid by the employer, the other half paid by the employee. If you're self-insured, self-made man, got your own business, you're paying the full 2.9%. Now, that's the history. I know I flew through that, and I apologize if that was too fast. But Doug, will you tell us a little bit about who gets Medicare? Like, how do you get Medicare in the first place?
Sure. And one thing I want to back up just a minute on the funding part. One of the problems that we're facing right now is that back in 1965, when it was created, life expectancy was not much longer than that. So the funding didn't have to last very long, right? Because
Sure.
people did not live as long. Well, today the opposite is happening. People are living longer, healthier lives. The medical industry are finding solutions to a lot of the problems that they did not have solutions for in 1965. But who is eligible? If you work for 40 quarters or 10 years, you're entitled to Part A. Now, you have paid into that the whole time. And once you reach 10 years and you have paid into it with your own money, you get Part A for free.
Okay.
How do you like that?
Yeah. Is it free? Yeah.
You paid for it the whole time. Now you get it for free. And that covers, Part A covers hospitalization, anything in the hospital. You are also eligible for Part B, which is your doctor expenses, and that comes out of your Social Security check. A lot of people don't even realize that, but it does come out of your Social Security check. And you are also eligible if you've been on Social Security disability for 2 years, if you have end-stage renal disease and on dialysis, and if you're Social Security disabled and have Lou Gehrig's disease. So that's just kind of a brief description of how you're eligible.
Okay, very good. Now, we've got a lot more to cover in this, but we're going to take a quick break right here. When we get back, we're going to talk about enrollment, timeline involved in this, and a split. Uh-oh, what's that going to be? Has nothing to do with Hollywood couples. I can tell you that right now. That's all when we return on Stress-Free Retirement on KZLS, The Eagle. Welcome back to Stress-Free Retirement, presented by Oklahoma Financial Group, your source for solutions to live a stress-free retirement. Reed Mullins here, alongside Michael White and Doug Rodwell. We're talking about Medicare. And when we talk about Medicare, there's a lot to cover. I just want to let you know that today we're going to touch on some of the high points. A lot more information is available from Oklahoma Financial Group via the website or these wonderful informational workshops. So, Michael, we'll get back into the schedule and timeline of those, but you have another timeline to talk to us about. First of all, when in the world can I start to get this wonderful Medicare anyway?
Well, absolutely. Let's talk a little bit about that. If our first segment didn't bore you and make you turn off the radio, let's talk a little bit about Medicare now. So the main reason that people are getting into Medicare is because they age into Medicare when they turn 65. The vast majority of people that enroll into Medicare is because they're turning 65 and they've got to make those decisions. So a couple things. If you're already drawing Social Security at age 65, so maybe you took Social Security early at 62, 63, 64, whatever it was, if you're already drawing your Social Security, when you turn 65, you're automatically going to be enrolled into Medicare. You're going to get a little piece of paper in the mail. Congratulations, you have Medicare now. Now, Doug's going to touch a little bit on it a little bit later, but you can delay your Part B if you're still working. You don't have to take Medicare Part B if you've got group insurance through your employer. There's a little box you can check, mail it back, decline Part B of Medicare, you'll be all right. Now, if you're not drawing Social Security, this is where it's going to take the most work. Say you wanted to delay your Social Security benefits until you're 66, full retirement age, but at 65 you're going to start taking your Medicare. I recommend, now this isn't a magic number, but I recommend 100 days before your birth month, really 3 months in advance. You need to go to the Social Security office or call the Social Security office and enroll into Medicare. You can go on their website and apply for Medicare right there on their website without talking to anybody. You can call their phone number and set an appointment to go meet with somebody in person.
Is this 3 months before my 65?
Yes.
Okay.
For your 65th birthday.
Okay. All right.
Correct. And so, as fun as that is, I recommend going to the Social Security office. It's not a fun place to be, but you're sitting face to face with somebody.
Yeah.
And in the business we're in, that's how I like to do business. I like to sit face to face with somebody. In a world where the internet is kind of taken over and everybody wants to do everything online without talking to anybody, the value of having a person in front of you is huge. And that's also part of what we do. We love sitting face to face with people and helping them make their Medicare decisions. So, if you're already on Social Security, it's going to happen automatically.
Okay.
If you're not drawing Social Security, you're going to have to do some work and enroll into Medicare and start the process about 3 months out before your 65th birthday. Of course, I already touched on the fact that you can delay your Medicare Part B if you're still working and on employer coverage. If you delay your Part B and you don't have employer coverage, later on down the road, if you want that Medicare Part B, you're going to pay some hefty penalties for that. That's one of those things that we dive into a little bit at our Medicare workshops, which, of course, you can always go see when those are at our website at okfingroup.com.
Okay.
So we've talked a little bit about the history of Medicare, who's eligible, when do I sign up. We haven't touched at all about what does Medicare cover.
Good question.
Exactly, yeah. So Medicare in general has got an 80-20 split. Medicare is going to pick up 80% of the bill. You're responsible for the other 20. Now, if you come to one of our workshops, that's one of those questions where we give out a coffee mug, whoever answers that correctly. Okay. So if you come to the workshop and you cheat because you know that 80-20 from the website, from our radio show, I'll probably still give you a coffee cup, but I'll give you a hard time. So the real core question of Medicare is, how do I take care of that other 20%?
All right.
The first thing is you pay for it yourself. You're taking on a lot of responsibility, a lot of risk. So there are a couple decisions to make. One of three things: buy a Medicare supplement policy, enroll into a Medicare Advantage plan, or if you have the option to go on to an employer retirement benefit plan, that's the third option. So if we can make it simple, which simple is what people want when it comes to Medicare. Tell me simply, what are my options? Medicare supplement, Medicare Advantage, or an employer group plan?
And I might just add that they don't have to do any of those. They can just pay for it out of pocket if they want to.
There's huge deductibles. And
that's generally not a good decision, but it is an option.
Yeah.
And you'd be surprised how many people we run across that have that problem.
But they'd be dipping into their nest egg, basically.
Oh, absolutely.
Yes.
Absolutely.
Wow.
So, and that 20% isn't capped. You can pay 20% forever.
My goodness.
And so it's important to make a decision, do something different. And there are options for every budget. And you hear every sales guy say something like that, but the truth is there really are options. Everything from very expensive Medicare supplement plans, a couple $100 a month, to some Medicare Advantage plans that can be as low as $0 a month. Now, it seems like it's too good to be true, but it is true. Unfortunately, Medicare regulates us. We can't tell you that kind of stuff over the radio or in group settings. It has to be a one-on-one appointment. That sounds like a sales pitch too, but we got these forms with all this government talk on it that we can go over with you that explains why it is the way it is. But the truth is, there are options for everybody out there, and you need to be talking to somebody about that. Now, Medicare supplement plans. Let's spend quite a bit of time there. The supplement plans are there to pick up all or part of what's left over after Medicare pays its 20%. So a Plan F is the most common supplement plan out there. A Plan F is going to pay all of the other 20%. You have that heart surgery, you get hospitalized, whatever it is, Medicare is going to pay 20%. The Medicare is going to pay 80%. The supplement's going to pay 20%. You're going to pay 0%. It's the most comprehensive medical coverage you can get while you're on Medicare. Now, Plan F, you notice I didn't say a company name. A Plan F is a Plan F is a Plan F is a Plan F. They are standardized, which means whether you buy a Plan F from Company A or whether you buy a Plan F from Company B, it doesn't matter. The coverage is going to be the same. Okay. So what we do when we're shopping our supplements is, how much am I going to pay for that Plan F? What kind of rate increase history have they had in the past? And are they a good company? They have good reputation, good customer service, things like that. Those are the big things that you really need to be looking at when you're looking at a supplement. Now, Medicare Advantage plans, they work in a little bit different world. You buy them from insurance companies. They're contracted with Medicare to offer these services, but they're not as standardized. So you pay co-payments when you go to the doctor. Maybe co-insurance, split the bill with the insurance company if you have different services. Co-pays for going to the hospital, the doctor, x-rays, MRIs, whatever it is. There's a co-pay or a co-insurance, but you typically pay a lot lower premium to have that. So you're taking a little bit of the risk by paying co-payments, but you pay a lot lower on a monthly basis to have a plan like that. Now, the third thing that I want to talk about is prescription drug plans. That's really a sore spot when it comes to people on retirement plans, because there's that dreaded donut hole.
Yes.
And some people might not know what a donut hole is.
That would take an entire show almost.
I do this for a living, and I'm not sure.
It's not something that you eat.
No,
the donut hole.
True.
I had someone once was telling me about the worst part of the donut is that hole where there's not any donut in there.
Yes.
And that's the same thing with these prescription drug plans. It's actually a gap in your coverage where you're responsible for most or all of your prescription costs. So it's too deep to get into, but you got to be aware that all these plans have them. They all have them. And so you got to shop each year, see what prescriptions you're taking, which plan's going to make the most sense for you. Here in a little bit, when we get back from our next break, Doug's going to get into what questions do you need to be asking your advisor, because it's important. You want to know what kind of work they do, what companies they offer, all those kind of things. And I guess when we get back here in just a minute, Doug's going to go over a little bit of the questions to ask.
All right, very good. And we will do that in our next segment when we return on stress-free retirement and Medicare made 1, 2, 3 easy on KZLS. Welcome back to Stress-Free Retirement and Medicare made 1, 2, 3 easy. I'm Reed Mullins along with Michael White and Doug Rodwell. And Doug, we heard a lot from Michael in the last segment, and that might have raised a lot of questions for people. Doug, you've got the answers, but sometimes we got to know the question to ask too, right?
Sure. And what I'm going to talk about in this segment is give you some advice on what to ask your advisor, and it has really nothing to do with the Medicare plan.
Okay.
But just questions to make sure that you're getting the proper advice.
Very good.
Okay. So I think first and foremost, make sure that they are a resident licensed agent in the state of Oklahoma. Now, we live in a part of the country where we get a lot of hail, a lot of roofers come in from out of state, and then they leave, and you never hear from them. And we have problems occasionally. So make sure that your agent is a licensed agent in Oklahoma. And verify that they are appointed to offer at least 6 different carriers. You need to have a broad view to choose from, not just one company.
Okay.
Ask if they have a bias toward one plan or another, and why. They may be a captive agent for just one company, and that I'm not saying that's bad, but
you need to know that.
You need to know if they have a bias and why do they have that bias. Ask if they have a dedicated live staff with real local people to answer your questions, or are they just a one-man band? And we're on the radio right now, and nobody sees this, but I'm holding up my phone, my cell phone,
Yes.
and all of our clients get our number of our cell phones in our office, and you do not have to press 1 for English. We are here local in Oklahoma. Ask for a complete and comprehensive side-by-side comparison, including every plan available in local county. Because depending on what kind of plan you pick, they differ from county, or they can differ from county to county.
Absolutely can.
So those are just some questions that we feel are important that any consumer ought to ask their agent and make sure that they're getting good sound advice.
Absolutely. What it really boils down to is, are you getting independent, objective advice? Is it coming from somebody that has one thing to sell, and that's how they make their living? God bless them, but it's not always about the advisor and how much money they're going to make and all that kind of stuff. It's about treating your clients right and giving them that objective advice that they're actually looking for. So these questions help identify independent agents. What customer service am I going to get? What plans do I have available?
Contact information is important. We're going to give that out to you right now, so get ready to write.
Yeah, let's give the phone number at 405-310-0098. Again, just want to point out it's a 405 number right here in Oklahoma City.
You bet.
And then, of course, you can always go to our website, www.okfingroup.com. That's FIN group.com. And then, of course, our email addresses are michael@okfingroup.com and doug@okfingroup.com. Okay. Of course, all of our contact information is available on our website at okfingroup.com. I feel like I just said our website 100 times. The last thing I want to go over is what our next show is going to be about. Medicare wasn't so much fun to talk about, but it's an important topic to know. Our next one is going to be a little bit more fun to talk about. We're going to talk about the top 10 biggest misconceptions about annuities. There's a lot of them out there, and so we're going to talk a little bit about annuities, the misconceptions. In fact, one of the ones we're going to go over next week are people often say, insurance companies keep my money when I die. That's definitely a misconception. We're going to talk about that next week.
That's very good, and that's where we'll leave it, and check you next time. See us back next week for Stress-Free Retirement right here on KZLS. The opinions voiced in this program are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which investments may be appropriate for you, consult with your attorney, accountant, and financial advisor or tax advisor prior to investing. On behalf of Doug Rodwell, advisory services are offered through Investment Advisors, a division of Pro Equities Inc., a registered investment advisor. Securities offered through Pro Equities Inc., a registered broker-dealer and member FINRA and SIPC. On behalf of Michael White, investment advisory services are offered through Red Hawk Wealth Advisors, Inc., an SEC-registered investment advisor. Both are Futurities First Insurance Group agents. Futurity First is independent of Pro Equities, Inc. and or Red Hawk Wealth Advisors.